So what I'm going to do is a little demonstration showing you just a walkthrough on hearing aid maintenance. So I'm going to take my hearing aid out of my ear. We're going to hold it up to the camera. And as you can see, this fat gray part that goes behind my ear, that's what collects the sound, amplifies it. Now, the kind I have is a RICI, a receiver in canal. This is not a tube. This is a wire. And this wire connects to this speaker, okay? And this speaker then goes inside my ear. Let's deploy this the right way. The speaker goes in my ear, and then it goes next to the eardrum. So the sound bounces off of my eardrum. But the good news with this kind of a hearing aid, you can see it's a thin wire and just a small tube that looks like a parachute. Okay, and with that, looking like a parachute, it deploys and it kind of doesn't lay against the ear, but more in the center of the ear canal. All right, so that's what we got. So the first thing I want to show you what we're going to do is we're going to change the hearing aid battery. Most of them, they just flip down like this. Give it a whack with your hand. Okay, it came out. And then you have your empty cavity here. And then you've probably seen them all in your stores. These are our hearing aid batteries. They come with these tabs, and do not tell your patients to take the tabs off until they're ready for use. Ideally, you open them, but in the interest of time, you want to wait about, 30 seconds or a minute before you put it in. And if you look real close, and you're not going to see it because they're real small holes, there's 3 tiny holes that allow the air to go in, and that's what activates the hearing aid battery. So we're going to pick up our hearing aid. We're going to slide our battery into that compartment, and we're going to close it until you hear a big click. All right. Hearing aid battery change, that's got to be done frequently, depending on the quality of hearing aid batteries you have and how loud your amplification is. I get about 6 days out of a battery. Some people get 3 days. Some people will get more than that. The second thing that we need to do is this end, the business end of our hearing aid, the cone, and then there's also a wax trap. And this is pretty fascinating. I'm going to pop the cone off. Okay, and now if you can see real close, see that little white gizmo? That's called a wax trap. All right, and this wax trap has to be removed and taken out. You can see that small hole in it. Now, can you imagine somebody with dexterity of a 90-year-old doing this? So what you do is they make it pretty easy. This is your wax trap loading device. Each one comes preloaded. See the white on that end? You see the black nub on this end? Let's try it this way. Here we go. See the black end? So you insert the black end in, nub end in, and give it a little push, and then a twist. There, I popped it off. Now we're going to flip it around to the new wax trap. We're going to slide it in, and again, just like a kind of bend and take it off. Now I've replaced the wax trap. Then I'm going to take my cone. I should probably put a fresh one on. So let me grab a nice new fresh cone. And it's just kind of like a rubbery thing. And it slides on like this. And now you can see we have a new fresh cone and a new wax trap. Now the reason that that's really important that we replace these every so often is the fact that if you get a wax occlusion in there, it kills the hearing aid. It kills it entirely. The first time that I ever had my hearing aids, within like a week, the one died. I said, what is wrong? Oh, I know, replace the wax trap. So I replaced the wax trap. It still didn't work. Took it to the audiologist, and here there was a chunk of wax stuck in the cone. And when it was stuck in the cone, that's what occluded all of my hearing. So change the cone, change the wax trap, and then if that doesn't work, then we can contact the manufacturer.